Welcome back. Today's segment is on breast microsurgery. We have Dr. Sonny O, who is a plastic surgeon, to talk about the topic with us. Thanks for joining us.
Thank you for having me.
What is breast microsurgery?
Breast microsurgery is a subspecialty of plastic surgery where breast reconstruction is performed using new and advanced microsurgical techniques.
Okay, is this breast reconstruction for somebody who has suffered from breast cancer or is just coming in for cosmetic reasons? Kind of explain to me why you would see a breast microsurgeon.
To take it one step back, breast reconstruction in general is performed typically by plastic surgeons.
Okay.
And microsurgery is a subspecialty of plastic surgery.
Okay.
The predominance of patients are patients who have been diagnosed with breast cancer and have been treated for breast cancer or are about to undergo treatment for it. There are certain instances where congenital diseases might require breast reconstruction, but by and large, it's the result of breast cancer.
Of breast cancer, okay. So somebody comes to see you, and where do we go from there? Are there options for them?
Absolutely. There are a lot of options, and I think that's a great question because I think what I try to focus on when I spend time with the patient is to go over the options in detail and spend some time talking about each option.
Okay.
Because typically, when a patient receives a new diagnosis of breast cancer, it's a shock to their system.
Right.
They end up meeting several physicians, a breast surgeon, a radiation oncologist, a medical oncologist, a plastic surgeon.
And at first, they're thinking about not dying. They're not thinking about reconstructing their breast at that point. They're saving, a life.
Exactly. So they're inundated with a lot of information.
Right.
And that's a lot for any individual to handle.
Absolutely.
So I feel it's important that we have some time to talk about what their options are so they can make a good decision, an informed decision about what their options are.
Okay, so the microsurgery is one of the options.
Yes, it is.
Tell me what is kind of the conventional way of doing this, and then we can get a little bit more in depth with the microsurgery aspect.
Sure. There are two primary ways of performing breast reconstruction, and one type would involve the use of implants.
Okay.
And there are appeals and attractions to using an implant-based reconstruction. The other type of reconstruction utilizes one's own tissues.
Okay.
And there are certainly a lot of advantages to using one's own tissues, which I'll speak of in a second.
Is there somebody who is a better candidate for one versus the other?
I think most patients are candidates for both types of reconstructions.
Okay.
It's just selecting out which would fit their needs better, what the patient preferences are, and then what the surgeon thinks would work best.
Okay, so say I opt for the microsurgery option. Why would I vote? I mean, why would I vote for that? Why would I want to do that? Why would I use my own tissue to reconstruct the breast? What's the benefit?
The greatest benefit is that it is your own tissue. Breast implants for breast reconstruction are widely utilized and are useful. However, they're still considered a foreign material from your body's perspective. So there is a chance of rejection, there's a chance of infection, chance of developing a hard reconstruction or a capsular contracture.
Right.
So if you use your own tissue, it's not a foreign tissue or a foreign body, it's something that's already yours and your body doesn't have to incorporate it.
So there's no implant involved at all with the microsurgery option?
With flap reconstruction and microsurgical breast reconstruction, implants are not used.
Because you read in the paper and hear on the news about leaking and all of these things happening out of implants, so that wouldn't even be a problem if you...
That is not a risk of flap-based reconstruction, correct.
So explain to me a little bit more about the flap-based reconstruction.
Well, one of the beauties of plastic surgery is that we're able to move or transfer tissue from one part of the body to another. And the mastectomy defect, or what's created following a mastectomy, is a very common defect or a common need. And we've come up with several different sites where we can harvest tissue. The most common or the popular site is the use of the abdomen.
Okay.
And there's a secondary benefit because a lot of patients have a little extra tissue in the abdomen, which they don't mind parting with.
Right, absolutely.
There are other sites utilized, including the buttock region, the thigh region, and even the back
Oh,
region.
yes. I'm sure no one wants to get rid of that. Okay, so there are options for you as
Absolutely.
well. Okay, and how do you decide where you're going to take?
Typically, it's determined by the surgeon and the patient, I think, during their consultation. You know,
Okay.
you can see what sites are available, what would make the best donor site for that patient. So I think it's done during the consultation.
So essentially you're moving fat and tissue from one location to the breast area to rebuild what was lost.
Yes. A distinction that I'd like to point out is utilizing the abdominal tissues, there's several different ways of moving that tissue.
Okay.
The newest techniques or the advances have focused on moving just the skin and the fat while preserving or sparing the muscle tissue.
Okay.
The significance of that is when you remove part or all of someone's muscle, you introduce some other risks, what I would call donor site risks.
Okay.
And those risks would include developing a hernia, developing weakness. If you think about it, if you needed bilateral reconstructions or both breasts reconstructed, and you needed to remove both of your abdominal muscles, that could impact your abdominal wall function and integrity.
Okay, so right now you're trying to just remove the fat.
The new techniques used today, and this flap procedure is called the deep inferior epigastric perforator,
Okay.
or the DIEP flap, transfers the skin and the fat while sparing the muscle.
Okay, what's recovery time like for patients?
I think most patients tolerate the procedure well. Hospitalization can vary from 3 to 5 days, and I don't think it's that much greater than somebody undergoing a implant-based reconstruction.
Okay, how long does the surgery actually take? And I'm sure you've got to find a specialized person like yourself to do something like this.
Yes, typically the surgeries can vary from 4 hours for a one-sided reconstruction to 6 hours to 8 hours for a two-sided reconstruction.
Okay, how common is a two-sided reconstruction?
I
In
think,
your practice, would you say?
believe it or not, it's fairly common. I think with the advent of genetic testing for breast cancer, with the increase in prophylactic mastectomies, meaning patients who...
Are you having people do that?
Absolutely, and I think
Really?
the studies are showing that through the years, those numbers are increasing. So having a bilateral or two-sided reconstruction is actually fairly common.
It's more common than you would think.
Yeah, it is.
Right.
Absolutely.
Okay, and I would assume that recovery would be a little bit longer for the people with the two-sided, and you would have to take more from other areas of the body,
Well, actually,
or not too
if
much?
the abdominal tissue is utilized, oftentimes patients have enough tissue in their abdomen to reconstruct both breasts. And since that donor site's already being utilized, it really does not add to the recovery time of the surgery.
You just get a smaller tummy after.
Absolutely.
Okay, how long have we been doing this?
The
Is this pretty new?
The procedure has been around probably for the past 10 or 15 years. We're fortunate in the Charleston area that this procedure is available in the Roper St. Francis system. There are a lot of parts in the country, a lot of major metropolitan areas where this is not available.
Where you can't do it.
Absolutely.
So what do you need to do if you've been diagnosed with having breast cancer? Who should you contact about this? I mean, should you talk to your doctor about putting you in touch with a microsurgeon as an option?
I think that certainly is an option. I think first and foremost, you need to get your breast cancer treated with your breast surgeon, with your medical oncologist and your radiation oncologist. And then facilities such as the Roper St. Francis system, which have surgeons in that system that offer this procedure, I think they can be available to see you and take care of you if need be.
It's really interesting surgery, though.
It really is.
All right, thank you.
Thank you.
And thank you for watching that segment. When we come back, we will interview Dr. Maria Latempio about lymphedema and tell you what that is. Stay with us. If not, I can add it in the intro, my little part.